We look at biceps elbow flexion, and we look at bicep and brachialis. Okay? Brachialis is probably one of the more undertrained muscles in an overhand athlete. The other thing is we see Dr. Droza mentioned yesterday about slap tears, superior labrum tears from anterior to posterior. And one of the reasons that they get these slap tears is that in their training, they don't apply a graded stress to the tendon insertion and give it time to adapt, right? We know that we have to apply a load to get tissues to adapt. And if we apply a graded load, that tissue will get stronger. If we don't apply a graded load, that tissue will break down. Or if we overload it too soon, it will break down. So that's why we keep the resistance low. I'm just using a tube here, okay? I've had patients actually try to do these just incidentally. You know, you have the T-curls in the gym with the cable pull machine is very popular. And you have guys, you know, they want to put, 50, 60, 70, 80 pounds on those things and start doing T-curls, right? I've had at least 6 patients come in with slap tears because of that. Why? There was no adaptation time. They put too much on too fast, and the bicep tendon pulled on the labrum and pulled it down. Okay? It was broken down. So what we do here is use a lighter tube, higher numbers. We use the bicep and then the brachialis by changing the hand position to pronation. So we take the bicep out a little bit, we put them in their cocking position, roughly 100 degrees, and now we apply a graded load. The other thing that has to happen here in order to do this, you have to have a stable scapula. Where does the bicep tendon attach? Both attachments to the scapula, the coracoid and the superior labrum. Those are parts of the scapula. So I need a stable scapula in order to do this. I haven't had a player that we've put this on who hasn't come in 72 hours and said, my ribs hurt. And they hurt right here. Because their serratus anterior has never worked like that before. It forced them to